Okay, so my name is Tyler, and today I'm going to be accessing my patient's implanted port. Basically, I'm going to be going in with sterile technique. We're going to be cleaning the area, going to be attaching a needle into her port, and then attaching a flush so that I make sure I can do aspiration of blood, I can make sure it's in the right place, and I can make sure that it's being flushed appropriately before antibiotic treatment. Basically, I'm gonna come in the room, wash my hands with all my gathered supplies. In this case, I'm gonna be using a needle of the correct size. I'm gonna be using a Huebner needle. I'm gonna verify the patient. Can you tell me your name and date of birth?
Samantha Conaway, 4287.
I'm gonna double check her wristband. I'm gonna make sure that I have a clean area. I'm going to go ahead. I'm going to just open my kit. I'm gonna come over here. I'm gonna opening using sterile technique my kit. I'm gonna take out my sterile gloves and my mask. I'm gonna explain to the patient in this procedure. I'm gonna need you to turn your head to the side if the patient has a bad cough. We're gonna put a mask on the patient as well as us wearing one. The patient is aware this is to maintain sterile technique of the area because we don't want an infected port. And move that. I have the sterile gloves right here. I'm going to put on my mask. Going to don sterile gloves, which I've ruined. Can I see that? Okay. There is one glove. I'm going to come underneath with this one. There's two gloves. Going to open my sterile field. Has also been ruined. Okay, now I've got all my supplies. I'm going to come over here and get my sterile IV catheter extension set. So I'm going to attach this, I'm going to attach this to the port. It's my saline flush or heparin flush, whatever. That's ready. I'm going to prime this through and get some squirts out of there. I'm losing my mask here. This mask has been used over and over, so I apologize. I would never touch my mask with my sterile hands in real life. Okay, I'm going to open the tubing. I'm going to prime the tubing, get all the air bubbles out, and then I'm going to close the tubing, and this is ready to go. I'm going to take my ChloraPrep here. I'm going to click it into place. I'm going to clean the area. I've located the port already. I know where it is. I'm going to clean the area for 30 seconds. I'm going to clean around the area where the tegaderm is going to go so that it sticks properly. Okay, now that we've done that, I'm going to go ahead and throw this over here. That's not sterile anymore. We're going to let it air dry. We're not going to wave it dry in this case, or in any case really. We're just going to wait a minute or two for it to dry. I'm going to attach my Huebner needle here in this. The Huebner needle is matched up with what's on the MAR with the doctor orders, the size that we need for this port. I'm going to go ahead, once this has dried, I'm going to stabilize the port, and I'm going to insert the needle. We're going to pretend like I inserted that needle right there. I'm going to go ahead, I'm going to aspirate for blood return, and then I'm going to flush, or I'm going to flush a little bit, then I'm going to aspirate for blood return. If it's in the right place, I'm going to flush completely. I'm going to close the line back up. Okay, and then I'm just going to leave that there for a minute. I'm going to use the tegaderm. If your kit comes with tape, you can use tape to stabilize that. I'm going to open the tegaderm, pushing around the edges as I go because you don't want any wrinkles or bubbles. And then once that's done, I'm no longer sterile. Tegaderm is on. Tegaderm is going to be labeled. The port's going to be access, I'm going to go ahead, I'm going to take out the flush. If I have a disinfecting cap, I can put that on. Either than that, or rather than that, anytime we access it, we're going to use an alcohol swab to access that. Basically, I've dated the tegaderm. I'm going to document how the procedure went for the patient, the size needle I used. I'm going to dispose of all my supplies, make sure that the patient's comfortable and okay. And once again, we use sterile technique the entire time. I have used these gloves 1,000 times on this mask 1,000 times. I wouldn't touch my patient's clothing. I wouldn't touch my face. I wouldn't touch anything. I wouldn't lean over my kit, and the area would have been clean beforehand. Anyways, that's it. The IV tube has been secured.